As we mentioned earlier, Senate Republicans are facing opposition within their own party over this new health care bill. At least 4 conservative senators oppose the current version, but they say they are open to negotiation.
The party can only afford 2 no votes from Republicans to pass the bill. President Trump has expressed optimism that a deal can be reached.
For more, we turn to Politico healthcare reporter Jennifer Haberkorn. She joins us now. So, all right, Jennifer, Democrats quickly slammed the bill as heartless. Explain for our viewers the key differences between this Senate bill and the one that passed the House in May.
You know, there really aren't a ton of differences. This follows the same general framework as the House bill. It repeals the major parts of Obamacare, puts some new policies in place. One of the biggest differences is that the House bill had the MacArthur Amendment. If you remember, this was going to allow states to allow insurance companies to charge sicker people more than healthier people. Obviously, that got a lot of political backlash. Democrats really slammed that. Even, President Donald Trump called the House bill mean. I think this was part of that analysis. What the Senate bill does, it doesn't allow states to do that. It takes that provision out. It allows states to opt out of some of Obamacare's consumer protections, but not that one.
Jennifer, there are 4 Republican senators, Rand Paul, Ted Cruz, Ron Johnson, and Mike Lee. They've all said they won't support the bill in its current form, but they're open to negotiation. What's their reasoning?
So they all argue that this doesn't repeal enough of Obamacare. Senator Rand Paul says that 90% of Obamacare is being maintained in this bill, and that he feels like he was elected to repeal the health care law. There's some other arguments as well. They say that it doesn't reduce premiums enough. Senator Ron Johnson wants more time to analyze it. He says that a week. Majority Leader Mitch McConnell wants a vote next week. Ron Johnson says that's not enough time to analyze this. So they have several complaints. But, when they put out their statement, I was expecting them to be very firebrandy to say, we can never support this. But they actually took a measured approach for this group. They said, we have some problems with it, but we're open to negotiation. And for Mitch McConnell, that's a good sign. He needs to make sure that everybody who has problems with the bill is still willing to talk about it, still willing to consider a negotiation.
Jennifer, the question I have is, does the president have a problem with the bill? On the campaign trail, he promised not to touch Medicaid and Medicare. This bill would make some deep cuts to those programs. What are you hearing?
It would make deep cuts to Medicaid in particular. And you're right, the president promised on the campaign trail he wouldn't touch Medicare, Medicaid, or Social Security. He has said that, he tweeted yesterday that he is a big supporter of the Senate bill. He looks to make it, I think it was more special. We don't know exactly what that means, of course, but the White House, in essence, endorsed the path the Senate is going on, and that includes a very big cut to Medicaid. We haven't been able to ask the president yet how he squares that campaign pledge with this bill, but for Senate Republicans, the cuts to Medicaid are really important because they argue that this puts Medicaid on a more sustainable track. And in the grand scheme of what Republicans want to do to health care, controlling Medicaid, as they say it, is a huge part of what they would like to do.
Jennifer, how about the time frame? In reality, could the Senate vote next week?
That's what Mitch McConnell wants to do, but you're right. It's a very, very tough timeline. There's plenty of senators who want more time to analyze this. And, yesterday when the bill came out, senators weren't, besides those 4 that we've talked about, weren't willing to draw any lines in the sand. They weren't willing to say, I will not vote for this in a week. So I think, early next week we're going to see senators, they'll have read the bill. If they come out with really strong opposition, McConnell might have to push that into the next month. Also, the CBO score is going to come out early next week. And I think what that score says in terms of how many people would lose coverage might have a big factor in whether this vote actually happens next week.
And that is, I think, the question that has been on my mind, because it is worth noting that the House version of the bill was passed even after the CBO concluded that 23 million people could lose their insurance. When these senators, if they vote for a bill that the CBO scores as badly as it did the House plan, are they going to face any kind of repercussions when they go back to their home districts?
Oh, absolutely. I mean, we're already seeing Democrats and progressive groups really coming out warning senators that they're going to hold them accountable in 2018 or 2020, whenever they're up next. So there's definitely going to be repercussions. And the Republican senators that I talk to say that they're aware of that and they are weighing it. Like I said, no one's gone to the point where they say that they're going to vote no over this. Senator Dean Heller in Nevada, he's probably the most vulnerable Senate Republican in 2018, one of the few Senate Republicans who's up in a contested state. And he put out a statement saying that he's very concerned about this bill. His governor, Governor Sandoval, put out an even stronger statement saying that he doesn't see that this is good for people's insurance coverage. So I'm sure that that statement from the governor is going to weigh heavily on Senator Dean Heller. He's probably the Republican that I'm watching most closely just because he is in the most contested race in 2018, and he's going to be definitely one to watch. All
right. There's obviously still a lot of debate left here. Jennifer Haberkorn, thank you so much.
Thank you.